On today's show, we're talking with cardiologist Dr. Christy Huff. In 2001, she graduated from the University of Texas Southwestern Medical School, and for the next 8 years post-med school, she went on to complete not only her internal medicine residency at Washington University in St. Louis, but also a cardiology fellowship with a specialty in advanced cardiovascular imaging. She eventually went on to work in private practice in Fort Worth, Texas for a few years, and after the birth of her daughter, decided to stay home and be a stay-at-home mom. Today, she and her husband, who also happens to work in the medical field as a radiologist, are still residing in Texas with their 7-year-old daughter and 3 dogs. But one day, about 2 to 3 years ago, Christy did what most of us do when we get sick. She went to the doctor. And that experience, after being prescribed a medicine, changed her life dramatically. And it was so significant that she's still dealing with the experience of taking that drug, which happens to fall under the category or class of drugs called benzodiazepines. Recently, I had the privilege to interview Christy about her experience with that medication and what she's doing about it now. And that's today on episode number 6 of Overprescribed. Welcome to Overprescribed, the show that raises America's awareness on pharmaceutical medications in this country, all in an effort to help you, the everyday consumer, to live the safest, healthiest, and most informed medication experience possible. I'm your host, Mika Pollack, and let's get started. So when it comes to benzodiazepines, this is really, the name benzodiazepine refers to the class of drugs that fall under that name. There are really specific drugs, though, that are benzodiazepines. What are some of the most common ones that people should know about?
Yes, so most of the commonly used benzodiazepines are readily recognizable by their trade names, such as Xanax, Valium, Klonopin, Ativan, or Librium. Those are the ones most commonly used in the United States. However, all of these medications at this point are generic, so patients, for the most part, will have the generic name written on their bottle. So, for example, Xanax goes by the generic name alprazolam, Valium is diazepam, Klonopin is clonazepam, and Ativan is lorazepam. So what I would say to you is if you have any question, if you are taking a benzodiazepine, please confirm this with your doctor or pharmacist.
So, Christy, your experience with benzodiazepines began about 2 or 3 years ago, correct?
Yes, that's correct.
Okay. And tell us about the first time you ever took a benzodiazepine and what led to that experience.
Well, I had came down with a case of very severe dry eye syndrome. It was basically a major health crisis. My tear production shut down. I was having very severe pain, visual loss. So I was having some anxiety and I couldn't sleep. My primary care provider prescribed some Xanax to help with insomnia and anxiety just temporarily while I was getting treatment for the eye problem. And I wasn't worried because I knew this was going to be a temporary thing, and I had been taught in medical school that these could be addictive, but since I don't have an addictive personality and I don't abuse my medications, I thought it would be safe. But just after a few weeks of taking a very small dose every night at bedtime, I developed a tremor and worsening anxiety during the day. And at first, I did not connect it with the Xanax, and neither did my doctors. So I underwent a whole bunch of testing. I saw 2 different neurologists regarding the tremor. I had thousands of dollars worth of testing done, including a spinal tap, which resulted in a complication and an ER visit. And all my test results came back normal. I finally started to suspect that there was a problem with the Xanax after I was asked to hold my dose for a medical test. And after I'd held the dose for about 12 hours, my muscles started to spasm and my chest clamped down so tight that I couldn't breathe. And after I took a dose of Xanax, all the symptoms melted away. And so by this time, I was having to dose Xanax 4 times a day to keep my symptoms at bay, because the dose effect was only lasting for a few hours. And just to clarify, I never did take more than was prescribed by my physician. And at that point, I was experiencing severe symptoms in between doses. I had shortness of breath, extreme fear, difficulty swallowing to the point that I couldn't eat. I lost 15 pounds. I was only sleeping 3 hours at night, and I would wake up in a panic with my heart pounding. And I discussed this with my primary doctor, and they chalked this all up to anxiety. But I wasn't convinced of this. So I went online and I stumbled upon the support forum BenzoBuddies, which is a website for people wishing to withdraw from their benzos. And it looked like my symptoms were being caused by interdose withdrawal. And what this is my body had become dependent on Xanax, and I was experiencing withdrawal symptoms between scheduled doses because of its short half-life.
So even though you took the benzodiazepine Xanax for just a couple weeks or so, your body had become dependent?
Yes. I would say the dependency for me happened within about 2 or 3 weeks. That's when I started to notice problems. And so at that point, I knew that I was in trouble, and I needed to taper off the medication. So since my primary doctor was not willing to help me, I found a psychiatrist, and he switched me over to Valium because it has a much longer half-life and makes it easier to taper. So it took care of those symptoms where I was withdrawing between doses. Now that I've been tapering the Valium, I still experience withdrawal symptoms, but it's not as much of the peaks and valleys as I was experiencing on Xanax. But I still have a very long list of debilitating symptoms. And I've been tapering for a little over 2 years now. And I'm down to about 20% of my original dose of Valium. So this has been an extremely long and difficult process.
Right. It sounds like it's a variable process depending on the individual, the difference in terms of how long it can take someone to taper. But tell us a little bit actually more about that. Tapering is something that I think that most people may not really realize may have to happen when you take a benzodiazepine or any prescription drug as prescribed. What is that process and why is it so important?
Sure. Well, the first thing you need to know, if you're on a benzodiazepine and you're wanting to come off, you should never cold turkey or stop your benzodiazepine abruptly, because that is incredibly dangerous. It can result in seizures and even death, and also extremely severe withdrawal syndrome. So different people, as you said, are going to be able to taper at different rates. Some people like me are much more sensitive, and we need to taper for years. Some people will be able to come off in the span of weeks or months. A general rule of thumb that we tell people, especially that are on long-term benzodiazepines, is to taper no more than 5 to 10% of your dose every 2 to 4 weeks. And this is based on guidelines in the Ashton Manual. And just to explain that further, Heather Ashton was a professor of pharmacology in the United Kingdom, and she ran a benzo withdrawal clinic in the 1980s and did quite a bit of research. And the culmination of that was an Ashton Manual, and she's got a lot of taper protocols and guidelines that are still used today by patients and healthcare professionals alike. And the key with tapering, everybody is going to be different. So we recommend you to go slow and to go based on your symptoms. As far as the methods that are available, the options are to taper straight from the current benzodiazepine that you're taking. Some people like me will need to switch over to a longer half-life benzo, such as Valium, to taper. And there's there's different strategies that you can use. There's the cut and hold method, where you cut a certain amount of your dose and then hold that until you feel like you're stable in the 2 to 4 week range, like we said. And some people do something called a daily microtaper, where you either use a scale or a liquid form of your benzodiazepine to cut very minute amounts on a daily basis.
So it sounds like, of course, as we know, this has changed your life in a lot of ways. But one of the good things about the experience is that it led you to actually being a part of a really important organization that you're now the co-director of today. And it's called the Benzodiazepine Information Coalition. Can you tell us a little bit about how that happened and what the coalition really is all about?
BIC is a nonprofit organization that was founded in August of 2016 by a group of patients like myself who were harmed by benzodiazepines. They didn't feel like they were getting any help from the medical community, and they really wanted to spread awareness about this problem. I personally became involved in October of 2016 when they approached me about writing my story for their blog. So I wrote an open letter to the medical community about my experience, and it has been shared with many patients, with their prescribers, and also translated into several languages since that time. Then I subsequently joined their medical advisory board, which is a group of physicians and other healthcare professionals who have clinical experience with benzos or have suffered from withdrawal themselves. And then a director position opened up in April of 2017. And I was approached about taking this position, and I gladly accepted because I feel very strongly about the importance of their mission. And since that time, I've been involved in the day-to-day operations of BIC. Our main goal is to advocate for awareness of the potential harm that can come from taking benzodiazepines as prescribed. So I'd like to share with you just some of what we do. First off, our website is an excellent resource for providers and patients alike. We have a very good resource section with lots of information. For patients, we have information on support groups. For prescribers, we have a list of prescribing guidelines. And we also have a list of doctors listed by state that are willing to help with tapers. We also have a blog that we're adding content to on a regular basis. And there's a specific section on our blog called Benzodiazepine Fundamentals for those patients and providers who are just learning about benzodiazepines. We are very active on social media and outreach through both Facebook and Twitter. We've been featured in several articles and have experts available to speak with the media if so desired. And then a big thing that we are encouraging patients to do is to report their benzodiazepine injury to the FDA MedWatch program, and are planning at some point to petition the FDA for a boxed warning on these drugs.
So there's no box warning at all on these drugs, or does it depend on the type of benzodiazepine?
Well, the drugs by themselves do not have a boxed warning. There was a boxed warning issued in August of 2016 for the use of benzos in conjunction with opiates. But for the drugs alone, there is no boxed warning. Okay,
so the coalition would like to see a standard box warning on all benzodiazepines placed across all labeling.
Yes, ideally that's the case, because if you look at the FDA labels for the different benzodiazepines, they're not standardized. They say different things. For instance, the Ativan label makes it clear these drugs shouldn't be used for more than 2 to 4 weeks. The other benzodiazepines do not have that definition of how long they're supposed to be used. So we would just like to see a standardization of these labels, and also a very stronger warnings on the risk of severe withdrawal syndromes, and actually a protracted withdrawal syndromes where people are suffering symptoms years out from taking the drug.
Right. I think that would be incredibly helpful. A few weeks ago, you had an article posted on the incredibly popular website, kevinmd.com. It's not your first article that you've been able to have shared through that particular website. And it was titled, The Internet Support Forums for Benzodiazepine Withdrawal, the Good, the Bad, and the Ugly. Now, this article has been shared over 100 times at this point on social media. And I wanted to zero in on the section, the ugly, as you titled that one there. And I wanted to see if maybe you can share with our audience some of the more, I guess, troubling or ugly sides of taking a benzodiazepine and what you have learned or observed, particularly through the benzodiazepine forums like BenzoBuddies.
So in that section of the article, I really zeroed in on the fact that this problem has been so under-recognized in the medical community, and the fact that patients are having to go to the internet, just like I did, to not only diagnose what's wrong with them, but also figure out how to treat themselves and taper off the drugs, which is, as physicians, that's not what we want to see. We would like to ideally be able to closely follow our patients and help them out. But what I'm seeing in these support forums is that doctors are just cutting patients off these drugs. They are tapering them too rapidly. They are just not well trained in tapering methods, especially for patients that are having more of a difficult time. So a lot of times these patients will end up either just left to figure out things on their own. Sometimes the patient doesn't know what's going on with them, and neither does the doctor, and they will just have other medications added on top of what they're already taking, so they end up polydrugged to treat the symptoms that are related to the benzodiazepines. They might spend thousands of dollars worth of medical tests trying to figure out what's going on. And a lot of them, not until they stumble upon these forums do they really see, hey, it's my drug that's causing all these problems for me. Right.
And I think that, if I'm not mistaken, at least from what I'm getting from even your own personal story, is that one of the ways and success for people when it comes to those who need tapering withdrawal support is that they really do need to have a very supportive healthcare provider by their side to help them with that. Not just maybe, the support forum, which has been great for many people all around the world, but they need a healthcare provider by their side. Would you agree with that? And if so, how can people, find individuals, or how can they recognize healthcare providers who would support them in that?
Well, that's been very difficult for our patient population, but I will tell you, we do have a list of providers that are willing to help with tapers on the website, listed by state, so that's a resource. And some people, it's just a matter of trial and error, trying to find a physician that's going to be able to work with you and supervise your taper, finding someone that's a good fit and that is willing to taper at the speed that your body needs.
And what I've heard is that these benzodiazepines are not just being taken by adults like you and I. They're also being exposed and being consumed by children and even elderly patient populations. Is this true? And can you tell us a little bit about that?
This is true. First of all, regarding children, they are used in certain situations, occasionally for things like anxiety or seizure disorder. We don't have a lot of experience with that in our support forums. I guess the kids aren't ending up on the support forums. But that's definitely a drug that, as a parent, I would never want my child to be on this drug unless it were absolutely necessary. So definitely do your research on that. And as far as the elderly, it's recommended that due to risk of falls and cognitive impairment that people of over 65 not be on these medications at all. And which gets to be a sticky situation because we have patients that are on long-term benzodiazepines and their doctors are now wanting them to come off of the medication, which our stance on that is, yeah, it's great if you can come off easily, but nobody should really be forced off a long-term prescription against their will without adequate support.
And I've seen this even in my own experience of working on drug research trials, is the debate between short-term versus long-term use of a drug. And I can imagine that for benzodiazepines, that's something also that's been proven and been mentioned on your website. And I would love people to know more about that. What is the big reason to pay attention to whether you're using this drug short-term versus long-term?
Sure. So most guidelines for treating things like anxiety are going to say that these drugs are only meant to be used short-term. They should not be used beyond 2 to 4 weeks. In fact, the Ativan label specifically says that they are not meant for long-term use more than 2 to 4 weeks. Although even in that, as I said before, dependence can even start within a week, and you would need to taper down after that. But if you look at all the FDA labels for the drugs, they do not recommend them for long-term use. And in fact, I believe 4 months is the longest period that anybody was actually studied. And so beyond that, we don't know how people do long-term.
And that's really interesting because, a lot of practices in prescribing, if I'm not mistaken, and at the point of clinical care, really rely on, research, right? That says that this is what's going to happen to a particular patient in a scenario. So it's validated, verified research over time. And if we don't know how it's going to behave in someone's body post 4 months, everything after that for anyone who's prescribed longer than that is really a guess in a lot of ways.
Right, that's correct. And we actually do have a link to a study from Upjohn on our website regarding Xanax and panic disorder. And people started to get worse after the 8-week mark. Their anxiety levels actually got worse than their pre-anxiety state before, or pre-drug state. So that's just something to be aware of. So
in July, there's something really important happening all around the world. Can you tell us about that?
Yes. July 11th of this year, 2018, will be the 3rd annual World Benzodiazepine Awareness Day. That's a mouthful, so we'll just call it WBAD for short. And it's a global patient-led initiative that also, like us, exists to spread awareness about the dangers of benzodiazepines. And the date was specifically chosen in honor of Professor Ashton, author of the Ashton Manual. We've already spoken about her, but July 11th also happens to be her birthday. So WBAD is active as an organization year-round, but on the actual day, people that have been harmed by benzodiazepines will be sharing their stories on social media such as Facebook or on YouTube. So look for the hashtag World Benzo Day on July 11th so you can see what's occurring on social media. And then patients that are more well feeling up to it may actually organize public events or hand out informational pamphlets at doctors' offices. So for more information at that, just look at their website. It's w-bad.org.
No, is there something specific that your coalition is planning to do on July 11th?
We are working in conjunction with WBAD. We'll be sharing the videos from their social media to our own social media page. We've actually are working on a video that we're going to release on WBAD. I'm personally writing a blog that I'm going to submit, hopefully to Kevin MD, that will be released around that time. And so we've got a few things in the works.
Okay, that's awesome. And yeah, you mentioned this already, but the coalition as well as yourself is very active on social media, and you and I actually met through Twitter. And so, I think the wonderful thing about what you're doing is that there's a presence there, and you're creating even another community and resource through social media. If people wanted to get in contact with you specifically through social media, or even the coalition, or even offline, how could they do that?
Sure. My email at the coalition is Christy, Christy, at benzoinfo.com. I have a personal Twitter account at Christy Huff MD, and that's Christy Huff MD. And there I've been tweeting about my personal taper journey that I'm undergoing right now. Our website itself is www.benzoinfo.com, and there you can find the details to our social media page, Facebook and Twitter.
Okay, so we've talked about this, and you've been very transparent, as you said, sharing and chronicling your withdrawal experience on a benzodiazepine on Twitter and other social media. And I just want to know, if you look back in retrospect over the last 2 to 3 years, what is the one thing that you would say you've learned and you want people to take away? If they took nothing else away from this episode, what's the one thing you really want them to know about benzodiazepines?
Sure. I think the big thing that I wish I'd known is that you can be harmed by taking these drugs exactly as prescribed. That dependency on the drug can happen in as short a time as a week if you take it on a daily basis. And so they're only recommended for very short-term or occasional use. And it does not require having an addictive personality or nature for this to happen. Dependence is something completely different from addiction. And I also had no idea of how long it could take a person to taper off this medication and how severe and debilitating the withdrawal syndrome could be. And if I had known these things, I would have never touched a benzodiazepine.
Wow, that speaks volumes. I thank you so much for taking the time to share the information about the coalition and share information about yourself. I think there's many things within our episode today that people can take away and utilize for themselves and for someone in their family. I want to encourage people to definitely visit the website. It's benzoinfo.com, and you'll find a wealth of information and resources there, more than even myself and Christy have mentioned here on the show today. So thank you again, Christy. I appreciate what you're doing, and continue to spread the word to millions of people all around the world.
Thank you, Mika. It was a pleasure to be on the show.
Well, that was our first interview of the entire show series, and I couldn't think of a better person to interview first on the Overprescribed podcast than Christy. Again, I'm so thankful for her, and I am wishing Christy, as well as everyone who's experiencing the withdrawal effects from benzodiazepines, a safe and speedy tapering experience. Again, please visit the website to read and to learn more about benzodiazepines and how you can protect yourself and your family. And I would love it if you can even go to their website and donate to the coalition so they can continue to do the great things they're doing and do even more than what they're doing right now. If you want to follow us on Twitter, you can follow us on Twitter at _overprescribed. Follow us, tweet with us, and if you want to access the show notes or connect with us a little bit further, you can go to our website at overprescribedpodcast.com. Again, that's overprescribedpodcast.com. Thanks for listening.